Well, joined now by Dr. Ama Adadevoh, who is Deputy Chairman, Dr. Amayo Stella Adadevoh Health Trust. I got that one. Thank you for coming on this morning.
Thank you so much for having me. It's a pleasure to be here today.
Well, it's a year on, and it was yesterday. Lots of people were talking about this, and really emotional for many Nigerians. So you can imagine how the family themselves are still dealing with it. What's been happening in the family about this?
Okay. My family, Amayo's son and the whole family, decided that we had to turn the pain of her loss into something positive. So what we have actually done is we've set up a healthcare trust in her memory to continue her legacy of saving lives. It's the Dr. Amayo Stella Adadevoh Health Trust. And the idea is to impact healthcare in Nigeria to improve the quality of our healthcare.
So how's that catching on at the moment?
Things are really coming along very well. We want to focus on strengthening the healthcare workers because they are the backbone of the healthcare system. Anytime a patient presents to any healthcare facility, the first contact are the healthcare workers. So they are the backbone of the healthcare system. In fact, Amayo, my sister, used to say the nurses at her facility were the heartbeat of the hospital. So we find that if we can focus our efforts on healthcare training, it'll help strengthen our healthcare system. We realize that preparedness for any potential future outbreak is what is required in this country. Nigeria is a great country, blessed with lots of resources, and a country cannot be strong if they don't have a strong healthcare system. There are gaps in the healthcare which we want to address. It turns out that two areas where there are gaps in healthcare, infectious diseases and ethics, happen to be things that my sister stood for. So we want to focus on those two areas initially. And like I said, focus on healthcare training at all levels. So doctors and all the way through.
You know, this is very key for the foundation. Just on Tuesday or at the launch of 3 books for the last governor of Lagos State, Babatunde Fashola, she was also mentioned in that particular book launch because they realize how much of sacrifice she has brought in. And if you marry that to the aims of this foundation, yes, it would seem as if it's already catching on. Some doctors from Nigeria went to Liberia and they came back all alive with no infection. It then means that the awareness for these people who come before people with infectious diseases, as your foundation is doing presently, is really working. For nurses, how is that also going for us, especially in Nigeria?
There's still a huge gap, which is exactly why we want to do what we did. And just to remind everybody of why this story is so important is that my sister, Dr. Amayo Stella Adadevoh, was the first person who diagnosed correctly the index case. So this gentleman presented, and initially it was thought he possibly had malaria. She saw him and realized it wasn't malaria, it was Ebola. The other thing that happened was there was tremendous pressure on her to release him by the Liberian government before they got the confirmed diagnosis. And she stood her ground and said there was no way she could do that. So the fact that she, contained him, first of all, correctly diagnosed him and then contained him, gave the government of this country, the chance to do a wonderful job that they did in terms of very efficient contact tracing. And that's why we were able to control and prevent this country being like the neighbors. Because even right now in Liberia, Guinea, and Sierra Leone, they're still dealing with Ebola outbreak. And the difference between Nigeria and those countries is the fact that they never identify the index patients. So if you don't know the source, how do you then do effective contact tracing? Now, going back to what we were saying about training, to tie this all in, my point is that my sister was not officially trained in infectious diseases, but she seemed to have a knack for diagnosing them. I don't know if you guys know that she was the first person in 2012 to diagnose swine flu, the first doctor in Nigeria. And again, this time, the first one to diagnose Ebola. And so it comes back to healthcare workers, because if she had missed that diagnosis, we wouldn't even probably be here talking today if they had thought it was something else. So the nurses are part of this, and there's a gap also with nursing care. That's why, nursing training, I beg your pardon. That's why I said earlier that the training will be for healthcare workers at all levels.
So in the long run, are you going to be looking to see how government policies could also be formulated to back what you're
Definitely.
asking for?
We plan to collaborate with the government. We can't do this alone. So that's part of our plan, to collaborate with the government in terms of policy, and even we would like to do research. These are things we can't do without collaborating with the government.
Because the other aspect is many may take some part of it for granted, but for the fact that she didn't budge when she was under pressure from Liberian government.
Yes.
I mean, certain individuals could put pressure on certain health facilities and health personnel and they budge. How much more a government? So how do you intend to also emphasize on that to the extent that many will just follow suit and even perhaps be a lot more stern when they insist?
That's why we want to introduce ethics. I'm so happy you asked that question, because ethics is one area of medicine that's very important, but in this part, in Nigeria in particular, it's not very well taught. So there's a huge gap there, and that's why I said we want to focus on ethics and infectious diseases, because obviously she was an ethical doctor. That's why she stood her ground and said, you know, I have a high suspicion that this is what you have, and if that's what it is, I cannot discharge you. And she was threatened to be sued by the Liberian government because they said she was violating his human rights, because she didn't have that diagnosis at the time. It ended up obviously being that she was correct, but she just stood her ground. That is ethics, and that's why we want to teach ethics.
So how does the foundation work? You encourage people to come forward, or you go to certain institutions to have certain meetings with them?
No. We will set up a healthcare training center.
Okay.
And we want to introduce something called simulation training, which is more like hands-on training rather than learning out of a book. It's been seen all over the world that when people learn hands-on, you first of all, you grasp the knowledge better and you retain it better, as opposed to learning out of a book. This is something that doesn't currently exist, and we are in the process of negotiating partnerships locally and internationally to set up the training center.
So how is it coming?
Very well. It's coming along very well. We have a couple of institutions here, because we need, like private institutions here to work with, and also internationally.
I know Nigerians are excited about her name and what she stood for and what she's done for the country, to the extent that till this moment, even for those who had forgotten that it's a year going on online media, it's awash with stories and tributes about her, and those that also went with her in that particular fight.
Yes.
What is the government, especially the Ministry of Health, doing in helping, or is this just a private enterprise that you just don't want an assistance or collaboration from the government?
We definitely want to collaborate with the government. This is not something we can do alone. The idea is to work collectively with the government, collaborate with the government to get this done, because we want to keep our eyes on the goal and the missions of the trust, which are to have a sustainable impact on strengthening the healthcare system. We want to build capacity in infectious diseases and ethics. I don't know if you guys are aware of this, but scientists around the world are predicting that the next threat could very well be airborne. And we can only just imagine what would happen if that happened and we're not prepared. Early in May, I was at an Ebola Lessons Learned event hosted here in Lagos. And the sum of it is that at the end of the workshop, it was recognized that if Ebola were to come back in Nigeria, we're still not prepared. So for us, with the trust, we are committed to doing this. It's a race against time, because preparedness is the way to go. We have to be prepared for the next possible outbreak. We can't sit back and hope that it doesn't happen, because it will happen. It's been predicted. This particular Ebola outbreak was predicted in the 70s or 80s, I forget. But we weren't ready. So we can't afford to make the same mistakes. The way I see it is that there's so much pain for us. We have to turn that pain into something positive. And so we're willing to work with the government. We have to work with the government. It's not something we can do on our own.
At what stage would you say you are now on this plan?
Okay. Right now, we are working with lots of partners. We have a formal launch coming up in October. So what happened was we've had a soft launch of the trust. But the formal launch where we announce everything we're doing is coming up shortly, and we'll make sure that everybody hears about it. And at that formal launch, we will announce everything we're doing. We're hoping that by then the partnerships would be like etched in stone and we can announce them. I can't announce them now because we're still negotiating, but things are moving along really well. The trust is governed by a 7-member board of trustees and a 4-member international board of advisors. And then we work with a lot of partners.
So location, Timberland, your office location will be where, Nigeria or outside?
Nigeria. It's definitely, everything's based in Nigeria. This is a Nigerian story. And this is, the goal is to strengthen the Nigerian healthcare system. It's something that should have been done ages ago. I honestly feel it's a race against time. We can't afford to waste any more time. It has to be done. You know, this is at the core of the strength of the country, you know. No nation can succeed and be strong without a strong healthcare system.
So how are people going to participate? I mean, are they supposed to come to the foundation, enroll, or how are you going to get them?
Yes. You mean for the training? Mm-hmm. Okay, we have various ways. Doctors, for instance, have to do continuing education courses to maintain their licenses. We will get accredited so that our center can offer courses for them, which they take yearly. And that will fulfill the requirement for the continuing education courses. We will also have relationships with local hospitals around, private hospitals, so that, you know, nurses, all the healthcare workers can come through and have training. And what I mentioned earlier about partnerships, there are right now 2 private universities that we're negotiating with, and one of them is looking very promising. Again, I can't, you know, mention names because we're still negotiating. But
in what way, to provide what, the facility, or
no? What we're hoping is that part of they can introduce part of the curriculum to be done through our center. That's the goal. So maybe for a month of, you know, a certain part of their training, they do it at our center. The other thing about simulation training is that sometimes it can be done on site. And what I mean by that is, if we had an agreement with Luth, for instance, we could take our simulation training equipment to the Luth campus if they prefer to have it on site there. A lot of the stuff is mobile and can be moved. So they don't always have to come to you. You can go there if they prefer that. But back to what you were saying, we plan to work with private universities and have part of the curriculum done through our center.
All right, that will be interesting, and we wish you all the best.
Thank you very much. One more thing real quick. So to get this done, I would like to invite everybody watching today to join the effort to make this possible. None of this can happen without funding. So we have a website, and people can visit the website and donate to the course, because every little bit counts. It's drasatrust.org, and DRASA is an acronym for her name, Dr. Ameyo Stella Adadevoh. So it's drasatrust.org, and we would appreciate anything. You know, every little bit adds up, but I feel like, you know, this is something that all of us should work together to make happen, and the way that everybody, the common person, can contribute is to give us a little money towards this. So please donate, and let's help build our country's healthcare system and strengthen it and prevent any future threats.
Yes, indeed, and the country will always, I think they'll be eternally grateful. We will be eternally grateful to your late sister, and we wish you again all the best. Thank you very much indeed for coming on this morning.
Thank you so much for having me.